One of the first persons hired by the health center was a librarian in the fall of 1965. Now, we didn't start our first class until 1968, so that meant they had hired a librarian 3 years before the opening day of the school. And they had to do that because you can't start a school without a library. At the very beginning, the library was located in Hartford. The library moved here in April of 1973. Initially, the students were everywhere. They had some student classes at stores initially, they had some classes here, and they had some classes in downtown Hartford. There was a lot of commuting going on in the early years here. When I first came here, we had a card catalog, and we had printed journals, and we had books. We did have audio visuals. In those days, there were 3/4-inch U-matic videotapes. It was very rudimentary paper-based information systems. When I left, there was no card catalog, of course. We had an online catalog, we had electronic journals, we had electronic books, we had digitized information systems, and we had computer labs in the library. The biggest advantage of making information available electronically is that the user can access that information anytime, anywhere, whether they're here at this institution or at home through their computer. I can't even begin to describe how effective it is to be in your office and look up a journal article rather than going to the library, making a photocopy, going back to your office. The usage of the library has increased dramatically now that it has been renovated. You can plug in anywhere in the library these days. You can study there with your own laptop or with one of the library's laptops or library computers. So the new designed library, coupled with the information technology, has put the library and the health center in a much more advantageous position. The biggest change has to be, biggest by far, is the number of women. The number of women coming to medical school. When I first started here, there were a few maybe. By the time 2005 came, well over half of the students were female. So women and minorities were big changes, for the better, because then you have faculty and a student body that's more representative of society at large than we had when I first came.